Hello, everyone. My name is Gloria Rodriguez, and today I'm going to be presenting my DNP scholarly project titling Faith Based Hispanic Community Breast Health and Nutrition Education Initiative. My committee members are Dr. Carla Larson, and my community member is Dr. Ping Cheng. A little bit of background. The aim of this project is to increase community awareness on the importance of breast and nutrition health, to improve breast cancer screenings in a timely manner, and cancer preclusions. Breast cancer is the second leading cause of death among women of all cultures. For this reason, it is recommended that awareness of the disease and its predisposition factors be increased among the Hispanic women. Women should be encouraged to take mammogram screenings early enough for prevention and treatment. Mammogram plays an imperative role in early diagnostic of breast cancer. They detect breast cancer at its earlier stages and can ultimately save lives. Women should consider having mammograms or continue to have routine screenings starting at the age of 40 or sooner if risk factors are present. Some of the barriers of breast cancer screenings are insufficient education on breast health, pain from the examination, culture, and perspective towards having a mammogram. There is a high prevalence of obesity at 80% among Hispanic women compared to 69 among the whites due to dietary issues. This is a quality improvement project which was implemented to improve breast and nutrition health among Hispanic women in a church based community setting. The purpose of the project was to determine if an educational intervention focusing on breast and nutrition health will allow women to start or continue having breast cancer screenings according to the American Cancer Society guidelines and to see if they will change nutritional habits. Literature review. The American Cancer Society indicates on average 1 in 8 women will be diagnosed with invasive breast cancer in their lifetime, and 1 in 39 women will die from breast cancer. The whites are likely to get earlier diagnostic of breast cancer and early stages compared to non Hispanics. Diets rich in vegetables, fruits, poultry, fish, and low fat had a 60% reduction in the probability of breast cancer. Studies indicate breast cancer is commonly inherited with 5 to 10% due to gene mutation, most commonly in the BRCA1 and BRCA2 genes. Nearly 50% of families with several cases of breast cancer, a number of other genes have been associated with the increased risk of breast cancer as well. Breast cancer remains the most common cancer and by far the second lethal form of cancer among Hispanic women. Except for skin cancer, breast cancer is the most common type of cancer among women today. Early detection and effective treatment for cancer has shown to improve survival rate. A growing body of literature examines the relationship between health, locus of control beliefs, and different health behaviors, which include cancer screenings. The central concept of health belief models include awareness of the disease, perceived vulnerability to the disease, apparent severity of a disease, professed factors to health behaviors, and perceived benefits of specific health behaviors, and indication to action. Breast cancer is a lethal form of cancer among females in America. Hispanic women are 20% more likely to die from breast cancer than non Hispanic women, in which this attributes to their diet and cultural beliefs. Lack of insurance and follow up care are one of the many challenges faced by Hispanic breast cancer patients. Most women who get breast cancer have no family history of the disease. Breast and nutrition health have been on the rising concerns for quite some time. Breast cancer risk is linked to lifestyle factors such as diet, exercise, alcohol, or inherited genetic mutation. However, only 5 to 10% is inherited genetic mutation. With Americans constantly being on the go, not many have time to go grocery shopping and meal prep. An author concluded strong evidence associated with being overweight, poor nutrition, and being inactive are linked to breast cancer. Interventions that would help with disparities are information for proper nutrition to help reduce breast cancer, also breast health screenings. One of the main contributing factors for Hispanic women are they will not get screenings for mammograms due to the expense of the diagnostic testing and the not knowing of the importance of screenings per the recommendation of the American Cancer Society guidelines. The literature reviewed three interesting themes among them. These theme factors were breast cancer being the most common cause of death among Latins, disparities in breast cancer, and breast health and how it contributes to nutrition. Breast cancer is a disease in which cells in the body, in the breast, continue to grow out of control. There are different kinds of breast cancer. The kind of breast cancer depends on which cell in the breast turns into cancer. Disparities are defined by factors such as race or ethnicity, gender, education or income, disability, geographic health disparities, are equable or are related to the historical or current unequal distribution of social, political, economic, and environmental resources. Poor nutrition, inability to miss work, lack of health insurance, cause of preventative tests, lack of immigration documents, lack of resources contributed to breast cancer risks. Solution: adherence to modifiable risk factors such as lifestyle habits and limitation of alcohol intake and is a public health concern that possesses increased cancer risk for women of all ethnicities. Theoretical framework. This study used Madeline Linenger cultural care theory as the theoretical framework for unifying this research regarding breast and nutrition health in the Hispanic population. The theory considers cultural preservation and maintenance, cultural care accommodation or negotiation, and cultural care for repatterning or restructuring during patient care. Social and ethnic disparities, how they contribute to socioeconomic status, late stage of diagnosis, and genetic factors, and lack of health care. Considerations prior to caring for a cultural patient include beliefs, information to be given in primary language, health disparities that may hinder the persons from obtaining the care needed. Several authors stated that racial and ethnic disparities in breast cancer incidence and mortality rate continue to be largely unknown. However, they contributed to socioeconomic status, late stage of diagnosis, genetic factors, and lack of health care. Methods and design. This quality improvement project was conducted in a one-day seminar to accomplish a quantitative study on awareness of breast and nutrition health. Pre and post questionnaires were administered. No participant identifiers were used. And then the information was uploaded onto an Excel sheet for analysis. Voluntary participants were the age between 21 and 55 years old. Consent was signed prior to the seminar, and a PowerPoint presentation was conducted for roughly 45 minutes. During the presentation, information was discussed was what age to start screenings, the number of servings of fruit and vegetable recommendations per day, and how many minutes of exercise should be done per week. This was a descriptive statistics used in scale data in one direction, which was based on effective size of zero point 0.4, a level of significance of 0.05, and an intended power of 0.8. Pre-power analysis was 44.4%, and post-power analysis was 77.8%. Excuse me. Methods and designs. Needs assessment. To increase awareness level and mammogram screenings, the design was based on voluntary participants. Inclusions and exclusions were considered, questionnaires, and a PowerPoint presentation. Data collection instrument was the pre and post questionnaires. The analysis, the number of responses needed to demonstrate the power, which was 41. 9 completed the pre and post questionnaire, therefore, descriptive rather than inferential statistics was used. The McNair test was used to calculate the results. The resources that were used was the printout of the presentations, and all the other required documents, the pre and post questionnaires, the shower cards, and of course, healthy snacks. The presentation took about 4 weeks to get together with weekly announcements, and the seminar was conducted on the 4th day. The protection of human subjects, data privacy, implied consent with no personal identifier information, and of course, approval was given by the IRB from Maryville University. Simple health education may be taught to the Hispanic community that can potentially be life-saving. It is vital to educate this community about the importance of breast and nutrition health in primary language. Furthermore, about the importance of mammogram screenings to help benefit generations to come. This was a quantitative study design with pre and post questionnaires. The project was conducted in a single day, utilizing descriptive pre and post questionnaires educational initiatives. Participants were voluntarily recruited with no obligations from a faith-based church. Participants were selected from a targeted community. The age range was from 21 to 55 years of age. Participants were recruited by announcements for 4 consecutive Sundays. Participants also went home with shower cards that can be used to do monthly self-breast exams. The sample, a total of 9 participants above 21 years of age were voluntarily recruited for the study. The inclusions were the following: to be between the age of 21 to 55, to have completed the pre and post seminar randomly numbered questionnaires, female, although the males were encouraged to stay, Hispanic, and to not have mammograms in the last 2 years, or to not continue to have scheduled mammograms screenings according to the American Society guidelines. The exclusions criteria was under 21 or over 55, males because the study was primarily focused on females, non-Spanish speaking patients, mammograms within the last year, which means they're being compliant, or have completed only the pre or the post seminar questionnaires. The emphasis was on Hispanic women in a local community. Hispanic women are a vulnerable population that greatly benefited from this culturally sensitive educational initiative. From the nine women selected, only 44.4% of the respondents were aware of the age of which women at what age to start having mammograms. Only 11.1% of the respondents were aware of the amount of fruit and vegetable servings per day. None of the participants knew the correct length of time they should exercise. 77.78 of the participants were within the 21 to 55 years of age bracket, and 22.22% respondents were outside this age. Though the well-designed research question, reliable data about women's frequency of daily exercise and regular mammogram screenings, this helped to explain the status quo of the spread of breast cancer. Selected eligibility criteria was used to ensure data adequacy and quality during the study. The chi-square quantitative test was used to describe the data distribution. At the end of the seminar, 77.8% were aware of the right age to start having mammograms. After the intervention, awareness of daily fruit and vegetable service did increase to 88.9%. And by the end, all of the participants were aware of the correct length of time amount of time to exercise daily. Participants were engaged for about 45 minutes. Before the intervention, a pre-intervention questionnaire was administered to capture the level of awareness about the appropriate age to start having mammogram screenings, the appropriate number of fruits and vegetable servings per day, and the number of minutes of exercise per day. The following are the results to start having the results that was to start having mammogram screenings. The first one is the results for the screenings. This one here is the results for the fruits and vegetables. And this one here is the results for exercise. Process, measure, and outcome are the following. As you can see, the numbers did increase significantly with in the post presentations. Again, this is the results, the table results, which again the McNeer test was used. Limitations, like in every study, the limitations was the participants were limited due to the unexpected pandemic and its regulations. The result was slightly biased, as 22% of them were well above the age bracket, hence his general assumption cannot be made. And the seminar was done in one session. Had it been done in at least 3 times, a greater significance would have been noted. At a 5% level of significance, the interventions had no significant influence of awareness of the age of when to start mammogram screenings. Conversely, the intervention improves awareness of the average number of fruits and vegetable servings per day and the length of exercise per day. Again, the McNeer test was used to calculate to determine the significance of this educational intervention. 44% of women who did participate supported the Revelation by Colin Otero. More prevalence among Hispanics. Low level of awareness and essential routine practice to control cancer among Hispanic women supported the findings, which concluded the high mortality rate among Hispanics. Low awareness on routine cancer control practice accounted for mortality rate among the Hispanic women as to their counterparts. The impact assessment analysis of this seminar showed a tremendous increase in the level of awareness of the age to start mammogram screenings, the number of fruits and vegetables intake required per day, and the number of minutes of exercise per day. The higher level of awareness and access to proper health care for early detection gave the white population advantage over the Hispanics, as concluded by De Jesus and Miller 2014. Discussion: cultural beliefs contributing factors on mortality. The study further shows that there is a relationship between cultural beliefs of Hispanics and health behaviors such as the perceptive towards cancer screenings. High mortality rate among Hispanics women included poor diet, poor access to health care insurance, and later stages of diagnosis, which ultimately early death. Other contributing factors was the nature of the diet, unhealthy weight, little or no physical activity, and poor access to insurance, late stage of diagnosis, and again, early death. How does this impact the practice? Impact for the practice: increase the number of breast cancer screenings among Hispanic women. Advanced practice registrars have the duty to educate individuals about screenings and, of course, documentation of action and education onto the electronic medical records. The study is relevant in design a better approach of healthcare providers toward public health awareness on breast and nutrition health. It also forms a good bias for future research to be conducted on breast cancer screenings. The data from research provides much required information for reference by future researchers. Conclusion: the Hispanic communities were the most affected in the study. The recommendation given was to start mammogram screenings at the age of 40 or sooner according to guidelines. Monthly self-exams, 20 minutes a day of exercise, 2 servings of fruits and 2 servings of vegetables, according to the American Cancer Society. Formulation of targeted health policies to accommodate the communities and curb adverse effects of breast cancer among Hispanic women. Also, to allow equitable access to health care. Incentives should be provided to individuals for breast cancer screenings. This enables Hispanic women to have access to equal health care through affordable health care plans with flexible payments. There is still a broader gap between the haves and the have-nots in society in terms of awareness, access to knowledge, and proper health care. Thank you so much, and I look forward to reading your questions and reference to them. Thank you.